Hey there, Kim Quintero here, Director of Communications for the Arizona State Senate Majority Caucus, and joining me today is District 25 Senator Tyler Pace. You've been a member since 2019, born and raised in Mesa, and you are the Vice Chair of the Health and Human Services. Thanks for hanging out with us today.
Well, thank you for having me.
So we're talking about one big move that happened in 2021 that you're super proud of, and it has to do with genetics testing. Tell us about that.
Well, thank you. Newborn screening is a process of when a child is born, they can opt into the ability to have a test for genetic abnormalities. One of the benefits of this test is you can identify some of the most serious genetic abnormalities at a young age and get treatment before they actually become a problem or have detriments to your health. Currently in the state of Arizona, we offer this, but we offer it for a very limited number of genetic abnormalities. Mm-hmm. We didn't require all of them to be covered by Medicaid, which most of our babies in Arizona are born under a Medicaid service, and it wasn't covered by all insurance payers. So previously, last year, what I worked on was expanding this genetic abnormality screening for our newborns to include all of the ones on the federal roster. There's a scale that has a list of all of these, to include all of them. And not only include all of them, but to include them for free for the children and their families. And successfully, we've identified several children in the state of Arizona who would not have been identified for genetic abnormality right when they're born.
And these genetic abnormalities can lead to cancers, different diseases, et cetera, correct?
They can lead to all different things. Mm-hmm. There's a whole list of them. Some of the more serious ones you can develop developmental disabilities if not treated early enough. One of the things from a public policy standpoint is if you can identify, prevention is worth an ounce of cure, right? Mm-hmm. An ounce of prevention is worth a pound of cure. We can identify these children at a young age and get them treatment and prevent or stay off any of the bad consequences that would come from knowing later in life.
Yeah.
A lot of these children, if they go untreated, it might cause a shock to the system, to them, or they could have, cognitive decline at maybe 9 or 10 years old, and the parents wouldn't know why. And then they would go and seek out treatment and discover that they had a genetic abnormality that could have been treated if they were identified.
This is pretty incredible.
Yeah, it is. It was one of the number one things for March of Dimes, is what their goals for the last 10 years was to expand this. And we're one of the very few states that have expanded it to include all of the genetic abnormalities that are testable.
And looking ahead to 2022, this next session, you're going to be focusing on moms. Tell us about that.
Well, last year I focused on the kids. Now it's time to focus on the moms. We live in a state where we love our Arizona moms, and we believe that everybody should have the opportunity to have a child if they would like one. And we want to make that experience as good as possible. Right now, most of our children are born on Medicaid or Access in Arizona. And what happens is, I don't have enough money to qualify for insurance. There's many options that I could find, but if I don't have enough, I qualify for Medicaid. But those moms currently, after they have their child, after birth, they're discharged from Medicaid. Mm-hmm. Their child will remain on the service for a period of months, but the mom is then taken off. What we know is that there are a lot of complications with having a child. I know this in my family. I know this from people I've met. There are many things that can go wrong. And you suddenly, just because you've had the baby, doesn't mean you don't need any more medical treatment, especially mental health treatment. We know postpartum is such a terrible thing to experience, and that goes a lot of the times untreated because they don't have coverage. So what I'm working on this year is expanding the average of 50 days post-delivery of their child to an entire year, 12 months after the child is born, that mom will stay covered on insurance and not be kicked off.
This is going to make a huge difference.
It does, and the best part about this is there are ways to get the federal drop-down dollars to cover these services. There are avenues in which we can do applications as a state through our Medicaid program to be able to bring those federal dollars into our state to treat our moms. So it's, we invest as a state some of our money, the federal government will contribute more, and we get outcomes where moms are better taken care of and they're healthier.
All right, Senator Tyler Pace, we look forward to watching this unfold in the next session, and thanks for hanging out with us today.
Thank you for having me again.